This is part 2 of the review for the test 2 for anatomy, chapters 5 through 9. If you take your feet and you stand on the sides of your feet where your big toe is off the ground, then that's going to be inversion. And if you stand where your big toe is on the ground and you're standing on the medial sides of your feet, then that's going to be eversion. So make sure you look at those pictures in the PowerPoints if what I said didn't make any sense to you. Whenever you can rotate your leg and your hip, that's called circumduction, so make sure you look at that picture. If you put your hands out and your palms are up, that's supination. If your palms are down, that's pronation. If you sit on the couch and you put your foot out and you arch your toe backwards toward you, that's dorsiflexion. And then if you were to point your toe outward and your heel outward, then that's plantar flexion. The knee is a synovial joint. The knee cap is a sesamoid bone. In your knee, you have lots of ligaments, like anterior and cruciate ligaments. You have bursa, meniscus, medial and lateral meniscus. You have a chamber that carries oxygen and blood and nutrients. And also you have the ability to carry waste away, because that's always important in your body. The anterior cruciate and posterior cruciate ligament cross over each other. The posterior, of course, is going to be in the back, and the anterior is going to be in the front. They help to connect your lower leg, your tibia and fibula, and your femur. You have different types of joints in your body. You have synarthroses, amphiarthroses, and diarthroses. Synarthroses is going to be not movable, like sutures on your skull. Amphiarthroses is going to be like your pubic symphysis, which is slightly movable. And diarthroses is going to be the ability to move like a ball and socket joint, like your femur. The outer layer of your skin is your epidermis. The layer of the epidermis that has papillae is going to be your stratum basale. And let's talk about all those layers of the epidermis. You have the stratum corneum, outermost, the stratum basale, which is the innermost of the epidermis. If you have 5 layers, then you have the stratum corneum, then you have the stratum lucidum, and that's going to be your extra layer whenever you have thick skin in your palms of your hands and the soles of your feet. Then you have the granulosum, which is the next layer. Then you have the spinosum, stratum spinosum, and then the bottom layer, which is the basale. The subcutaneous or hypodermis layer is composed of large quantities of fat or adipose. Melanocytes aid in protecting you from UV radiation, and your melanocytes produce melanin. The stratum basale is the deepest or bottom layer of the epidermis. The stratum granulosum is filled with lots of keratin. The stratum spinosum has about 8 to 10 layers of keratinocytes, and you know those produce keratin, which is a waterproofing layer. The layer that produces all the other layers of those 5 layers we just talked about, corneum, spinosum, lucidum, granulosum, and basale, the layer that produces all the rest of those is stratum basale. So your skin is always getting new layers formed and getting pushed up, and the top layer is shedding off. The layer that is only present in thick skin is stratum lucidum. Remember, Lucy's in the extra layers of the hands, the palms of the hands and the soles of the feet. Lots of dead keratinocytes would be in the corneum, the stratum corneum layer. The layer of the epidermis that is characterized as constant shedding of dead keratinocytes and constant replacement is once again the stratum corneum. Sometimes your skin can get disorders, and some people have these disorders, and one of them is called vitiligo, and that's depigmentation of patches of skin, so your patches of skin would be lighter and whiter looking. Absence of skin pigment, which can be hereditary, is albinism. Red blood cells are made with red bone marrow. The process of making red blood cells is called hematopoiesis. Your periosteum on your bone is very tender. People, and most everybody, has bruised their shin, and so you know that hurts really bad, and the periosteum is very tender. Yellow bone marrow is used for fat storage. Osteoclast function in reabsorption and breakdown of your bone, of the extracellular matrix of your bone. So they're like bone breakdown cells, because you don't want your bone to get too thick and heavy, because when that happens, it can cause acromegaly. Osteogenic cells develop into osteoblast. Make sure you look at that PowerPoint picture of the maturation of bone cells. Endochondral ossification causes cartilage to be replaced with bone. Periosteum in bone is rich in sensory nerves. Those osteocytes, which are bone cells, help to maintain your bone tissue. You also have mesenchymal cells, which are going to help produce chondroblast, which in turn help to produce cartilage during development. Vitamin D is really important to your bones because it helps the promotion and absorption of of calcium and potassium. Rickets. Kids can get rickets if they have a lack of vitamin D, which can cause soft, weak bones. Your pubic symphysis is a type of cartilaginous joint. Your sutures are a type of fibrous joint. Your knee is a type of synovial joint. In your bone, you have lacunae, which contain osteocytes, which are those bone cells. Your primary ossification center is going to be your diaphysis in your bone, which is the middle section of bone. Parathyroid hormones and calcitonin are also going to be really critical in balancing your calcium and potassium levels within your bone. We had endochondral ossification, which is going to take bone or cartilage and replace it with bone. And you have intramembranous ossification, which is going to aid in forming spongy bone. Make sure you look over the PowerPoints and make sure you look at all the pictures of for terms like supination, pronation, etc. And that concludes our review.